本節目為醫療資訊節目，內容及觀點僅供參考，並不代表本台立場。如有任何健康疑問，請諮詢專業醫療人員。
歡迎收睇今集嘅醫護與你，我係 Christina 梁展穎，
我係馮振中醫生。
今集我哋會同大家探討一個影響數百萬計男性同埋冇一乜症狀嘅疾病，佢就係前列腺癌同埋泌尿嘅疾病。今集我哋仲會訪問 Dr. White 同埋 Dr. Kong， 佢哋會同我哋講解前列腺癌同埋骨盆重建手術嘅程序。
請大家收睇啦。
係，你好，我姓冼嘅。我今年有62歲，咁我平時咧由細到大咧就冇乜點身體咧好冇乜點去睇醫生嘅。點知突然間最近呢半年前啦，我就發覺已經都唔係半年㗎啦，都2-3年，晚晚去廁所咧，夜晚咧就去咗多咗，去咗2-3次嚇。我咧以為係呢個好多人男人普通嘅病，好似前列腺肥大咁樣嘅。咁我又唔係咧，我就會定期就做呢個高血壓，要見醫生，咁咧去抽下血啊，驗呢個高血壓指數㗎。咁我話俾醫生知，我話我而家最近有夜尿多咗喎，會唔會係前列腺肥大啊咁樣？咁跟住醫生話咧，咁我同你做一個前列腺嗰個指數啦，抽啦嚇。點知2月一抽就發現我係7.7。呢個前列腺癌咧喺香港嚟講咧就係已經係第4號殺手。係好多男士都會有機會中嘅，只不過佢係有分良性同惡性。我而家咧就已經係由良性變咗惡性啦，因為根本我都唔知道會有咁嘅情況。好多人都唔會諗住，最多以為好多男人嚟講咧，最多話小便唔暢順啊，淨係最多係肥大啊，即係個尿管收窄咗肥大。原來唔係嘅，一定要去檢查，睇下佢你有冇機會遇到呢個腫瘤。
阿白醫生啊，咁點解其實美國咁多人都會有前列腺癌嘅？
Prostate cancer is a highly prevalent disease in the United States. It's often diagnosed in men between the ages of 55 and 70. And then we often hear about men who are older who are also diagnosed with prostate cancer. So because it's so prevalent, it's something that we try to identify in as many people as possible.
咁啊，白醫生咧就話其實好多長者或者55歲或以上嘅男士咧都會有前列腺癌嘅問題喎。咁請問咧前列腺癌係有咩症狀嘅咧
？Unfortunately, prostate cancer typically has no symptoms. When it's confined to the prostate, it usually produces no changes in your urination. Typically, blood in the urine is very uncommon. Occasionally, when prostate cancer is spread elsewhere in the body, you can have things like pain in the bones or pain in the back. And so that's why we always screen for prostate cancer in middle-aged men.
阿白醫生咧就話其實前列腺癌咧好多時都係冇症狀嘅喎，咁可能佢發現嘅時候咧都已經開始比較遲㗎啦。咁可能有啲人會覺得好攰啦，或者可能前列腺嗰個位置下體嘅位置可能會有啲痛啦。咁 usually at what stage do people find out they might have some problem, or do they find out they have prostate cancer?
When prostate cancer is caught early, it's usually confined to the prostate and hasn't had a chance to spread elsewhere in the body. And when it's confined to the prostate, we have a certain set of treatments for everything from surveying the prostate cancer and watching it without intervening to taking out the prostate or treating with radiation. There's even emerging treatments involving what's called focal treatment of prostate cancer. If prostate cancer is spread elsewhere in the body, then we take treatments that treat prostate cancer wherever it is spread.
阿白醫生啊，請問前列腺癌係有乜嘢嘅階段嘅咧？
When prostate cancer is caught early, it's usually confined to the prostate, meaning it hasn't spread anywhere. That's early stage or prostate-confined prostate cancer. Later, as prostate cancer progresses, it'll spread to the lymph nodes and then elsewhere in the body, and that's called metastatic prostate cancer. Your primary care physician or your urologist will test your blood for PSA, which is a marker for prostate cancer. They can also do an exam of the prostate using their finger. And if there's any concern on either of those exams, they can do further testing involving an MRI or a biopsy.
白醫生啊，我想請教下你啦。通常男性咧要幾歲開始咧要做呢一個檢查嘅咧？
So screening for prostate cancer should be done between the ages of 55 and 70. After age 70, you can make a decision with your healthcare provider to decide if it's appropriate to continue screening. Younger than age 55, if you have a family history of prostate cancer or from certain ethnic backgrounds, we start prostate cancer screening earlier.
其實我哋華人咧有時佢哋會覺得好難開口啊，即係好尷尬，唔知道點樣求醫嘅關於呢一啲泌尿嘅問題。咁其實你點樣教育佢哋咧，或者你點樣鼓勵佢哋要尋求協助咧
Because prostate cancer and its treatment relates to urinary function and sexual function, it can be a difficult topic to bring up with your doctor, but it's something that we deal with every day, and we'll work our best to make sure that you're comfortable during the workup and during the treatment process.
咁啊，白醫生頭先同我哋講咧，其實呢一個係比較 sensitive 啦，比較敏感嘅話題。咁好多病人咧都可能唔願去同醫生講啦，因為呢一個咧係牽涉到去廁所啦、去小便啦，同埋可能佢嘅sexual dysfunction 嘅。咁但係白醫生咧就話其實咧大家就唔好怕醜，咁就有咩事咧就盡量咧就打開心窗就同醫生講啦。咁其實好多醫生都見過晒呢一啲敏感嘅題目㗎啦，所以佢哋都唔介意會同病人傾訴下呢啲敏感嘅話題嘅。
多謝李白醫生頭先咁清楚嘅解釋。咁而家問你就係，如果係發覺真係前腺癌病嗰陣時咧，證實咗，咁有咩要做咧？
So when prostate cancer is detected on a biopsy, the things that we'll learn from the biopsy are the grade and condition of the cancer. Then we'll perform what's called staging. If you haven't already had an MRI, we might perform an MRI, and we might look at elsewhere in the body, including a CT scan or a PSMA PET scan, which is a new scan that can detect prostate cancer wherever it is in the body.
哇，仲有咁多嘢要做嘅。當我哋做完晒呢啲試驗嗰陣時，咁治療有咩方法咧？
So once prostate cancer is detected and staged, our treatment options depend on where it's found. So if it's spread throughout the body, we use things like medicine to treat it. When prostate cancer is confined to the prostate, we have a range of options for treatment from active surveillance to focal therapy to surgery or radiation.
係如果做觀察追蹤嘅方法，係咩病人、咩種病人要咁樣做咧？同埋要做幾耐咧？
Active surveillance consists of watching prostate cancer to determine how aggressive it is. So we'll repeat a PSA blood test, we might repeat an MRI, we might repeat a biopsy over the course of a few years. And depending on how the prostate cancer behaves, we may continue active surveillance or we may recommend an intervention to directly treat the prostate cancer.
好啦，咁如果個情況係好快咧，漸總得好快，咁會唔會有問題咧？
If the prostate cancer is well behaved, we may continue active surveillance indefinitely, and we may never need to intervene on it. If we see that it's progressing or it spreads elsewhere in the body, then we may recommend another type of treatment.
好啦，如果我哋需要係再做多啲嘅話，有咩唔同嘅手術咧？
So the most effective treatments for prostate cancer are radiation or surgery to remove the prostate, and an emerging treatment is focal therapy, where we just treat the part of the prostate that has the cancer.
咁荷爾蒙治療係有咩方法同埋有咩幫助咧？
When we treat prostate cancer, we typically use either radiation, which is performed by a radiation oncologist, or we remove the prostate using a robot, which is performed by a urologic oncologist like myself. So the role of hormones in the treatment of prostate cancer are basically in two places. When people receive radiation for their prostate cancer, sometimes we will add hormone therapy to enhance the effect of the radiation. Or in the case of prostate cancer that's spread elsewhere in the body, hormone therapy can be a useful treatment at that stage.
咁多治療方法咧，好多病人都驚有冇副作用咧？尤其是會唔會係尿失禁或者性功能受影響咧？你點樣能考慮呢啲問題同埋解釋俾病人聽咧？
So urinary symptoms after treatment for prostate cancer is common. When you're treated with radiation, it usually takes the form of urgency to urinate. When you're treated with surgery, it can take the form of a little bit of urinary leakage. Incontinence after prostate surgery is about 10%. Other men are pretty much dry, but occasionally need to wear a pad for a few drips here and there.
好多男性都驚住有性功能阻礙，咁有咩方法可以避免呢？有咩方法可以治療呢？
So men who are getting treated for prostate cancer are often at an age where difficulty with erection is common. And so when we treat patients who've had treatments for prostate cancer for difficulty with erections, we use things like medication, injections, or sometimes surgeries.
而家我哋有咩新嘅進展？有咩方法可以幫助呢個問題呢？
So the management of prostate cancer is a quickly evolving space. The robot is a useful tool for removing the prostate. For staging prostate cancer, PSMA PET scan is probably the most exciting new development in that area. For diagnosis, the emergence of MRI as a tool to guide our biopsy of the prostate means that we can have more accurate prostate cancer diagnosis. For treatments of prostate cancer, an emerging area is focal therapy, where only the part of the prostate that has cancer gets treated. The important thing to know is that as the treatment of prostate cancer evolves, you can always trust your urologist to recommend a treatment pathway that is tuned to your specific situation and needs.
咁點解基因會係咁重要呢？你話可以基因檢查，你可唔可以解釋多啲呢？
Prostate cancer does have some genetic roots. We know that prostate cancer can run in families. In fact, part of my motivation to treat men with prostate cancer is that my family carries a gene called a BRCA gene that causes aggressive prostate cancer young in men's lives. In some cases, there is a role for genetic screening, especially if you have a family history of prostate cancer. Unfortunately, we don't really know what causes prostate cancer, and that's why it's so important that men talk to their urologist about the necessity of screening for prostate cancer.
喺我隔離咧就係泌尿科醫生 Dr. Kong 鄺醫生，鄺醫生你好。阿鄺醫生啊，你可唔可以同我哋講下一啲關於骨盆重建手術嘅程序呢？
The organs of the female pelvis, the vagina, the bladder, the rectum, can sometimes descend in women. This would be as a result of traumatic childbirth, genetics, or surgeries such as hysterectomy. And this results in a variety of symptoms, urinary incontinence, the sensation of mass, painful intercourse, and female pelvic reconstruction works to restore comfort and function to these ladies.
江醫生指喺某啲情況之下，女性可能因為創傷性分娩、子宮切除或者之前嘅手術，需要接受盆骨重建手術。
所以鄺醫生啊，你可唔可以同我哋講下咧？通常咧啲人係有乜嘢問題啦，或者症狀咧，咁需要做呢個手術嘅咧？
So some of the things that I see in the office would be prolapse or descent of the bladder or the rectum. Urinary incontinence is a very popular one. Urgency and frequency of urination, pelvic pain, and there are treatments for this that are sometimes surgical, but also sometimes multidisciplinary or even medicine-based. So it really would depend specifically on the complaint and the medical and surgical history of the patient.
需要接受骨盆重建手術嘅患者，佢哋嘅症狀包括骨盆器官脫垂、膀胱或者直腸下垂、尿急或者骨盆騰動等嘅問題。
鄺醫生啊，你可唔可以同我哋講解下做呢個手術咧，通常要幾耐啦，同埋我哋康復嘅時間係要幾耐咧？
In general terms, the most complicated surgery would perhaps take one night in the hospital with discharge home the next day, most times without a catheter. However, there are a lot of procedures that can be sent home the same day. Generally, we would want someone to have limited physical activity for about 6 weeks after surgery. But after that, you'd basically have your entire life back, from exercise to intercourse to running.
所以鄺醫生咧頭先話，通常呢一個手術咧，就有啲人可能住院一晚啦，咁跟住其實好快咧都可以做翻其他嘢㗎啦。咁但係佢話咧做完手術後6個禮拜咧，都最好咧就唔好做咁多運動啦，即係最好係即係可能留喺屋企啊咁。咁但係6個禮拜之後咧，其實佢哋都可以開始運動啊，做翻以前日常做嘅嘢。 鄺醫生，我想請問你咧，咁做完呢個手術之後咧，佢會唔會覺得好痛楚啦？或者會唔會有啲特別嘅嘢佢哋唔做得嘅咧？
I've found females to be very resilient in that area of the body. I have not had a lot of pain complaints. It's very common for someone to tell me that they didn't take any of the pain medication that I've given them at all, although of course I would supply them with some. The only real precaution would be not lifting anything greater than 10 pounds for about the 4 to 6 week mark. Other than that, they're functional immediately, walking, even driving as long as they're not on any pain medication.
咁鄺醫生話咧，佢好多病人咧康復得好快喎，即係好多時候咧佢哋做完呢個手術康復完嗰時可以揸車啊，或者做好多其他活動啦。佢話唯一一個咧唔可以做咧就係你做完手術嗰時候咧就唔可以咧就舉重舉超過10磅嘅嘢，咁因為可能會導致出血啦，或者導致其他問題，咁所以就大家就要注意下啦。鄺醫生啊，你可唔可以同我哋分享一個故事啦，或者你病人嘅故事啦？即係佢有啲問題啦，跟住做咗手術之後就康復咧。
I think some of the most satisfying surgeries that I've performed were on patients with severe prolapse. There are multiple ways of fixing it, but when your bladder, rectum, or vagina is protruding out of your body, it's very restricting. Restricting in what you can do, restricting in what clothes you wear, restricting on where you go. So after you fix this for somebody and they no longer have that kind of discomfort, it really gives them back their social life, gives them back to wearing the kind of clothes that they want to wear again. So those are the most satisfying to me.
鄺醫生頭先話咧，佢有啲病人咧，佢有啲器官咧就係好似係跌咗落嚟咁樣，咁就影響佢哋個美觀啦、感官啦，或者着衫啊等等。咁佢話好多病人咧做咗呢個手術之後咧，咁佢嘅自信心翻嚟啦，同埋感覺上咧佢身體都覺得係舒服啲嘅。鄺醫生，你可唔可以同我哋講下 El Camino 醫院咧喺呢度嘅手術方面或者支援咧係有咩服務咧
？All of medicine is going towards more of a minimally invasive technique, and we certainly offer that here at the El Camino Hospital. Larger surgeries can be done robotically, and as a result, with minimal bother to the patient. And we are able to accomplish a lot of these things as an outpatient as well.
鄺醫生咧就話咧 El Camino 醫院咧就好多有啲高科技嘅服務啊，例如佢話其實好多手術咧都係用個機械人一齊輔助嘅，咁有時咧有啲可能手術程序咧仲要可以喺一個診所就已可以做得到啦。
鄺醫生，好多人以為咧泌尿科咧多數係男性㗎，原來女性都好受影響，尤其是年紀大嘅女性。你可唔可以同我哋解釋下呢啲情形呢？
So there are common themes that are shared between both males and females. Urinary incontinence, urgency and frequency of urination, UTIs, which are urinary tract infections, or voiding dysfunction, which would be difficulty urinating or not being able to urinate at all. However, the reasons behind why a male or a female may be experiencing these problems can be vastly different. So that's why finding someone who's well versed in both types of problems may be valuable.
江醫生話，男性同女性都有常見嘅問題，例如泌尿道感染或者尿失禁。不過，導致呢啲問題嘅成因，男性同女性可能有所不同。
咁樣好多病人都唔願意嚟睇醫生，尤其是係女性。我哋點樣能夠鼓勵佢哋同佢家庭醫生講，或者嚟睇你個科呢？
So I think that embarrassment at the subject matter would be a primary barrier for people finding help. There's also a general sense that what may be happening to them happened to the previous generations and is just a natural part of aging. But I just kind of want to get the message out there that that's not necessarily true and that there are options that are available to them. I think that another barrier might be that once you decide to come forward and try and find some help, finding the right provider. urology is a very broad topic, and we all have our niche and our interests. And some people are interested in seeing patients with these issues, and some providers are not. I think a way that a patient could better spend their time would be to find someone who has the designation of female pelvic medicine and reconstructive surgery that just designates that either a urologist or a gynecologist has sought out additional training to be better able to help them.
好多人因為覺得尷尬而唔去求醫，有啲人仲以為呢個係老化嘅正常現象。江醫生強調唔需要覺得尷尬，應該主動揾合適嘅醫護人員去幫助，先可以得到最好嘅治療方法。
江醫生，我哋最近 El Camino 有個 Men's Fair， 係咪每年都有呢？同埋係咪大家公眾都可以參加呢？
So it's an annual event that's open to the public where various professionals, be it physicians or even within industry, would get together to help to educate the community on what's available for the treatment of male health.
每年 El Camino 醫院都會舉辦男性健康博覽會，提供有關糖尿病、健康飲食、泌尿科等等嘅全面資訊。呢個係醫院其中一個最受歡迎嘅活動。
阿 Kong 醫生啊，我就好想知道咧，好多女性咧，佢生完 BB 嘅時候咧，都會有子宮下垂嘅情況喎。同埋，究竟乜嘢係形成子宮下垂咧？係咪我哋華人嘅文化咧？係咪因為冇坐月咧？
Well, I don't think that not resting is the only cause for prolapse, but I can tell you that I do see where those recommendations come from. There are certain ethnic groups that seem to be more penetrated by this problem. People of Asian and Latin descent seem to have more prolapse than people, let's say, of African American descent. So, yeah, I can definitely see where that comes from.
好多生完 BB 嘅女性都會擔心有子宮下垂嘅問題。江醫生表示，呢啲問題喺亞裔同埋拉丁裔嘅族群較為普遍。
阿 Kong 醫生啊，我想請問咧，究竟你子宮下垂嘅症狀係乜嘢咧？
So it can be as mild as just feeling something that ought not be there when you're cleaning yourself, or to as severe as needing to actually move your organs out of the way with your hand in order to get urine or stool out. So there's a wide variety of symptoms.
子宮下垂嘅症狀包括喺清潔嘅時候有異物感、骨盆或者陰道有沉重嘅感覺，或者需要用手嚟移動器官先可以排尿或者排便。
Kong 醫生啊，假如我哋真係出現呢一啲子宮下垂嘅症狀啦，咁我哋去見你尋求協助啦，咁係咪手術係唯一一個治療方法咧？定係會唔會你會有其他嘅方法可以治療呢個病症嘅咧？
So I want people to know that even though urologists are surgeons, when you come to see me, surgery is not the only thing that I can offer you. I try to offer a multidisciplinary approach to giving you care, and your problem could be potentially solved by medication. I would involve physical therapy, so not necessarily surgery-based.
Kong 醫生咧就話咧，就算咧，假如出現呢啲問題咧，你去見佢嗰時咧，佢唔會淨係鼓勵你做手術嘅喎，因為其實咧好多方法都可以治療呢一個病症嘅，例如可能服用一啲藥物啦，或者可能做物理治療咧，都可以幫助同埋改善呢一個病症嘅喎。咁好多謝 Kong 醫生今日同我哋分享咁多寶貴嘅知識啦，關於男士咧同埋女士嘅疾病喎。咁我哋下次再見。